Going live?
Yeah.
Just a second. Yep.
All right. So welcome everyone. It's a pleasure to have you all here with us with the ebaithak with Disha Shetty. Today we'll be talking about disinformation and the state's response to COVID-19. Before we get into introductions and the flow of the discussion today, I'd like to take care of some housekeeping rules. So first and foremost, I'd request everyone to see if their names are correctly displayed. You can change them. You might appear as Shaurya Banerjee. That's a default error. So just go to the More button and click on Rename to have your name reflect correctly. Secondly, I'd request everyone to keep yourselves on mute and keep your videos off for the duration of the discussion. The conversation will flow as follows. I will introduce Disha and the topic, following which Disha will take the floor and have the main address. After the address, we will go into a Q&A session where participants will be allowed to ask questions to Disha. For this, we will share a link, a Slido link with you, which you can click on and feed in your questions. You can also upvote questions that you think are more important to get them at the top of the screen so they have precedence in order of being asked. And once that is done, we will have closing remarks from Disha. So ladies and gentlemen, once again, welcome. Let me introduce Disha. Disha is an independent journalist currently based in Pune. And she has written extensively on malnutrition, maternal health and child health, infectious disease, and the impact of climate change in communities across India. Disha holds a Master of Science, Environment, and Medicine Journalism from Columbia University and is also the winner of the Global Health Reporting Contest Award 2018. Her work has appeared in various places, including Forbes, Vice, India Spend, and The Wire, among others. Disha, it's a pleasure to have you here. Over to you.
Thank you, Krish. So I'm going to start with the main presentation, and then we can take over. We can move on to the Q&A. So I'm going to share my screen here, and just let me know if you can see it and when you can. Can you see my screen?
Yeah, the slide's visible. Thanks.
Yeah, perfect. Okay, so I'm going to talk today about disinformation and the state's role in disinformation related to COVID-19 in the past few months. I'll start with the beginning of the pandemic. So when India had its first COVID-19 case in January, last week of January, and we had cases beginning in the state of Kerala. So that's where the first cases were before it spread to other parts of the country. So at the start, we weren't very sure of what the science was, how the disease was spreading, whether mask wearing needed to be mandatory or if only sick people needed to wear masks, or what material of masks needed to be used, what the best strategy would be, whether lockdowns are effective. So essentially, there was a lot of confusion. And this confusion was not just restricted to India, but the WHO kept changing its guidelines. So did the CDC in the US. So we were all learning and experimenting, and new research was coming constantly. So WHO for the longest time, even till July, did not, or I think somewhere in the month of June, did not really say that you have to mandatorily wear mask. It recommended mask wearing, but it didn't say that wearing a mask would stop the transmission of the virus. Meanwhile, several Southeast Asian countries, which had previous experience with SARS, for instance, quickly moved to mask wearing. So there wasn't resistance to mask wearing in those countries. And it had to do with their earlier experience and how fast their public health systems moved. And that's not something that we really saw in the West. In India, we were, I wouldn't say there was a lot of resistance to mask wearing, but there wasn't one clear message that was going to the people from the government. Also, with health being a state subject and different states responding differently and the central government responding differently, there was essentially a lot of confusion in terms of information. And this was not intentional, of course. This was just the nature of the pandemic and how everybody was learning on the go. Now, initially what India did was India restricted access to testing. And the WHO's guideline at that point was to contain the pandemic, you have to test, isolate, and contact trace. Right. So if there was somebody who had tested positive, then you had to reach out to their contacts and make sure that they were indoors. Again, mask wearing was not a part of it. So when India went to into the lockdown, we actually had not we had just about expanded testing to everyone 4 days before the lockdown, which meant that initial few weeks of the spread of the virus, we had severely restricted testing to people who had just traveled abroad or their close contacts, and in the few weeks it kind of was evolving. But when we had our lockdown, access to testing was not widespread, and it has since become widespread, but at that point we weren't there. Sorry. So what happened with respect to the communication that was coming from the state? One thing India did get right was when our Prime Minister announced a lockdown, he made sure that he communicated that you had to isolate yourself and minimize social contact, etc. But then there was also a lot of mix of tokenism, come to your windows to bank thalis, etc. So there was, I wouldn't say the communication was entirely science driven, but there were a lot of Indians who were responding to that communication style. So essentially the government had a good opportunity there to communicate scientifically with the people and make sure that whatever latest information we had at that point in time, we could have communicated to the people. And initially we did, except, access to testing was a major issue, but the communication wasn't a problem until then. But as the pandemic progressed, we've seen a lot of mixed messaging coming from the government. So you had Ayush Ministry pushing a lot of untested medicines, guidelines that were coming in, which was not very clear. There were media houses that were talking about different kinds of remedies. Again, we didn't know whether they were proven at that point in time. And there was a lot of information that was flying through WhatsApp, which wasn't necessarily coming from the government or the media, but there was a lot of building on the lack of communication or wherever there was information gap. And from there on, you could see that those rumors were starting. But then one major incident happened with respect to Tablighi Jamaat, where in Delhi there was a congregation of people, and some cases of COVID were found there. And that is essentially where India's major disinformation campaign started, where the health ministry in its press conference disproportionately focused on the cases from that particular incident. One of the things that the media did at that point in time was essentially not question the government. I'm sorry, I'm just trying to find one slide. Right. And at that point in time, because the testing was not widespread, the first question should have been, how many people from other states have we tested to say that the cases are only from this particular congregation? And how many people had we then contact traced from that point on? And government was constantly in its health ministry conferences talking about the Tablighi Jamaat, and media was constantly publishing more information about that particular event, ignoring crucial questions about access to care, about why migrants were walking home, about the panic that the people were facing, about the women who were locked in their homes with their abusers, about the lack of access to maternal and child health during this period, about routine immunizations that had been disrupted, TB care that had been disrupted. And suddenly you found this focus from media and from the government on this particular incident. And all of March was this disproportionate focus on Tablighi Jamaat and and we lost as a country crucial time in expanding testing, in asking the right questions at that point in time, which might have prevented the cases from going to this number as we stand right now. We have the second largest number of COVID-19 cases in the world after the US. And our lockdown itself, there were the government kept defending the lockdown, and it put out maps like these, graphs like these, where essentially this was sometime in April, where the government essentially said that when the lockdown ended in May, the cases would fall to zero. And clearly it was not scientifically sound, and yet maps like these were reproduced by sections of media without questioning it properly. Now, there are reasons why this happened, obviously, and I'll go into that sometime from now. But the immediate impact of this kind of disinformation was the rise in stigma. And we still don't have exact numbers as to, or studies looking at how this, to what extent this has had an impact. We only have anecdotal evidence from doctors who say that people are worried about seeking care. Health-seeking behavior was affected. Generally, there was, and not just mixing religion with the pandemic, but there was generally a lot of stigma associated with COVID. And you found that a lot of people who might have had symptoms of COVID would not have actively sought testing. There was also a lot of controversy about the testing costs, and for this talk, I won't go into that. But essentially, there was a very small section of the media that was actually asking the right questions. The result was also that government officials who had the capacity to, or who were the decision makers and policy makers, were not necessarily held to account by the same standards. Now, this also happened because the lockdown had restricted movement of the media itself. And so there was very little reporting that was happening that was from the ground. So essentially, you were depending on the government, who was also the source of disinformation. You were depending on them for all information and official communication as well. And the government seemed to be focused more on building consensus for lockdown rather than focused on, how do you deal with the pandemic at this stage. Now, this was not just an Indian problem, although mixing religion with the virus might have been a local phenomena, but broadly disinformation that was coming from government sources themselves was a global problem. You had the US president tweeting about mask wearing, even after the WHO essentially made it mandatory for other people to, or at least recommended that mask wearing could help. And then there was this recent survey by International Center for Journalists that spoke to journalists in about 125 countries, and almost uniformly, about 46% respondents said their politicians in their respective countries were actually the top sources of disinformation. And the tricky part was, for any confirmation, you still had to go to the official sources. So it was a catch-22 situation. Now, also, the media saw a lot of job losses across the world, in India and abroad. And that obviously affected the way media was covering COVID-19. Now, what did this do to journalists? Now, as a journalist covering the pandemic, firstly, my mobility was restricted. So there was very limited access. Second, I was also worried about my safety, and a lot of journalists found themselves in that position. And especially in an atmosphere where we don't necessarily have a lot of backing, any sort of protection. So as journalists, we were in a position where we had to take a call for ourselves. Some journalists chose to go on the field, some others did not. Then with respect to the disinformation, now our concern was, how do we report this? How should we go after calling out the misinformation and focus our attention there? Should we focus on just reporting facts, but then again, the misinformation was coming from the government? So how do we carry press conferences that are actively in a sense sometimes spreading lies, and not always, right? So there was a lot of conflicting information. A lot of it was accurate, some of it needed more questioning. So how do we do that reporting? And finally, do we report on solutions? And in a situation where the solutions were also evolving, so there was no consensus on lockdown. There was confusion about whether Sweden's model of keeping the country sort of open was working, or whether the New Zealand model was working better. There was some country. So essentially, we were also kind of looking at global sources. We were trying to reach out to our colleagues internationally. And for us as journalists also, this disinformation presented a big problem, because we weren't sure how to allocate our time, and what percentage of people were actually falling for this disinformation. So essentially, there was a lot of that confusion that was happening. Now, with respect to health reporting, now what this pandemic has done it's suddenly made health reporting important. However, so far, health was also always considered as a soft beat. Now, I want to unpack this a little bit. In a traditional newspaper, what a reporter covers is decided by the beat that they have. So a beat is your area. So for instance, I have been a health reporter. So in traditional news organizations, you might have somebody covering the civic body, somebody covering law, somebody covering the courts, somebody covering education, and health and environment. So these would be sort of the main beats, and of course, sports and entertainment. So now within this, some beats have traditionally been considered hard beats and some others soft beats. Hard beats are beats where, for instance, that involve crime, judiciary, your civic corporations, politics, etc. Soft beat would be health beat or environment beat. Soft beat would be sports beat, would be entertainment beat, right? So you would find a lot of the soft beats not being considered headline worthy, for instance, unless something very drastic happened. Now, this has been changing. Now, I've been a journalist for about 10 years, and I've almost, when I graduated, there weren't, Scroll wasn't out there, Wire wasn't out there. So the whole digital media boom is fairly recent. Now, when this boom happened, that's sort of the first time we started getting feedback on what people care about. What are people reading really? Are people really not reading about health? And then we started getting information about, no, actually, people are reading about health. But traditionally, our mindset is, there is some evolution that's happening there. But the mindset is still that health is a soft beat. And I don't see anything soft about writing on trauma or deaths, malnutrition, for instance. But that's how traditionally we've seen it. Now, when the pandemic broke out, you had a lot of journalists who had never covered health suddenly write about health. That there was disinformation there you would see amplifying points that a traditional health reporter would know. Actually, this is how our country is. We actually have the largest number of TB patients in the world. The statistics of maternal health, for instance, infant mortality, it's anybody covering health beat would not be surprised to find a lot of things. But you suddenly had political reporters reporting on health, and they would amplify big things that a health reporter might not have amplified. And you suddenly had your own editors writing about health, and it got us into tricky positions where do we want to really tell them that this is actually not a story? Or homeopathy, no, within the medical community, homeopathy is almost considered a pseudoscience. So do you want to interview him, a doctor, homeopath who's talking about COVID remedies, and give him or her the platform? So you saw a lot of that, which was from the media side, right? Amplifying that kind of information. Now, there was also the realization, and some of this has been happening for some time, that misinformation involves many players. So there's the media, there's the government, there are also social media platforms. We know that during the genocide of Rohingyas in Myanmar, social media platforms have played a huge role. We have evidences of people talking about, how they went to join ISIS, and they learned about it on Facebook groups, for instance. So for a long time, there has been this pushback on what do we do? Do we ask for regulation? How do we handle this kind of disinformation and misinformation? Twitter has stepped in recently during the US elections, and there is the criticism that Twitter does step in only when it comes to developed countries and not really developing countries. And there are countries where Facebook officials will not step in to regulate or flag off content that is actually known to incite violence in the real world, whereas they would take a different stance, maybe in the US. Of course, there are media initiatives and fact-checking organizations now that do regularly fact-check. And so you had Boom Live and Alt News, for instance, calling out some of the reporting by mainstream news media, but also what is going around on WhatsApp. Now, what can be a possible solution? Now, again, since it has multiple players, some of the solutions have emerged. So you have Twitter, for instance, stepping in to flag off Donald Trump's tweets. So can that be done for other countries as well? But these are conversations that we need to have. Like, when do we do it? In what situations should this be a regular thing? There is obviously need for media to report on itself as well. And you have, News Laundry that ran a campaign on Stop Funding Hate, which looked at who are these advertisers that are funding hate on news channels and went after them. And a lot of advertisers actually pulled back from funding organizations like OP India, for instance. But this is not consistent, and this is still an ongoing process. And in fact, when job cuts happen in journalism, there's very little writing that happens about it. So the media reports very little on itself. And that would be a crucial gap to fix. I would say there's also need to train regular people to spot fake news. For instance, my parents' generation essentially did not even learn computers and possibly went straight to mobile phones. So they don't know the concept of a URL. So the how do they find out or differentiate between news organizations? And through my conversations with some people who are not of my generation, I understand that it's actually quite confusing for them to understand what they're reading and whether it's a legitimate publication or not. And so there is a need to address this. I'm not sure how it can be done, workshops, for instance, but I don't know if you can scale it up to that level where you can reach a large number of people, for instance. Policy interventions are tricky because obviously once you let the government or any sort of legislative body come into the space, it essentially opens you up to censorship. Right now, during COVID time itself, there were about 55 journalists who found themselves either behind bars or FIRs were registered against them for reporting on the pandemic. But even apart from COVID, right now we have a lot of journalists and activists behind bars. We, as a journalist, you have to think 100 times before putting out a tweet, because if you don't have institutional backing and the institutions decide to come after you, who's watching your back? And so it's a tricky space. And finally, it's more a question of how will the policy help when the government itself, when the government itself is a primary source of disinformation, when it some of the disinformation, and again, not all of it, some of it has come from health ministry press conferences. And so how do you tackle that via policy, for instance? So that's it from my end for now, and I look forward to your questions.
Thanks, Disha. I think you really gave us a sort of wide perspective on how the issue played out in terms of the media and COVID-19 and the reporting on it. So we have a bunch of questions in the back end. Shorja, do you want to take over?
Yeah, sure. Sorry, can you hear me, Disha?
Yeah, absolutely.
Hi, great. So a quick question first was specifically related to what we were talking about, is where somebody's asking about whether, in your opinion, social media should be regulated in terms of allowing people to share unverified information, and whether we currently do it adequately.
Right. So this is tricky because whoever does step in, they're going to bring their own sensibilities in the picture. And so I don't know if social media should be regulated, but there's also evidence that we've gotten to a point where we might have to, that might be our only option. Because if you've had Facebook groups play a role in helping people organize violence outside in the real world, then there is something that we need to do. So, for instance, what Twitter did with the US election campaign was quite effective. But can we do that at a regular basis? I don't know. Also, then that gives the social media or the organizations like Facebook and Twitter and all of these companies disproportionate control over our lives. And so these, I think, are constant conversations we'll have to have, and we will need a lot of reporting on the fallouts of this. So I would say that it would have to come from two ends: from the social media companies, yes, but B, also from the society, from the civil society, from media organizations together. It cannot be one organization doing something about it. I don't think it'll work like that.
But not a blanket governmental policy decision. Is that what you're saying?
Yeah. I'm saying not a blanket government policy, but not just a blanket social media policy from a company as well. It might not work in every country because, of course, it's the value systems are different everywhere, and what might work for one country cannot for another. So, yeah.
Thank you so much.
I had a quick follow-up on that. Sorry if I could just interject. I'm sure I'm not aware of this, but I read somewhere once that the fact-checking that happens since we're on social media, the fact-checking that actually happens, say for instance, Twitter and Facebook are flagging certain posts, we all take for granted that an algorithm is working through these things. But is there also a human element in this at all? I know algorithms are programmed by human beings, but are posts actually being checked individually?
I believe so. The posts are being checked by Facebook. Like Facebook does have a group, from what I understand, and so does Twitter. But they don't do it uniformly. Like for the US elections, for instance, they did it actively. But otherwise, it's also driven a lot by who is complaining. So, for instance, if trolls decide to go after my reporting, if I've been critical of the government, then that reporting would never show up if we had that kind of an algorithm in place. Which is why I said who the moderator is, and then their sensibilities, or whatever the company's sensibilities are. For instance, we have some reporting by a journalist named Kunal Purohit. He's done some reporting on Facebook and how Facebook's moderation works in India. And the reporting says it's different from how Facebook approaches the same posts, maybe if it was in the US, or in case of a US politician versus an Indian politician. And so there is room for a lot of manipulation there.
Yeah, thanks for addressing that. Shaurya, carry on, please.
Thank you so much. So there are a couple of questions on more or less the same line, so I'll just club them together. They're asking your opinion whether you think the government, in an attempt to manage its response, tried to give out less information and then increase the spread of disinformation in a sense.
So the government has not been transparent. We had to, as journalists, we have to work very hard to get government's perspective at all, firstly. And our government is not a government that regularly holds press conferences, though during the COVID time, also there was actually a phase where for weeks there was no press conference, as our cases were, I mean, it was unbelievable, the level of the lack of transparency that was there, and the lack of accountability and straight up gaslighting. If you were a journalist and asking a question, there were journalists who were trying to get. Oh, by the way, one basic information: if you're a digital journalist, you don't get a press card, right? So the government of India does not recognize you as a journalist. I don't have a press card because I write for digital publications. So and in fact, the government is now moving in to regulate funding to digital media. And so we're working in a very constricted space, first of all. And we're open to a lot of harassment. And so we're taking a lot of risks there. In terms of, so these press conferences were obviously happening in Delhi, whatever little press conferences were happening. So if you were a journalist who were not reporting from Delhi, you don't have access to these press conferences. Then the government had Health Ministry had a WhatsApp group where journalists could ask questions, and the ministry would choose what questions it would want to answer. So transparency was a big issue for sure. What the government was trying to do is obviously manage its image. And I would say it did manage its image well, because a lot of people actually believe that the government did do very well. That is open to interpretation, but generally the consensus seems to be that the government did well. The lockdown, there's very little data on the impact of lockdown, like hard numbers on what that has done. From the stories that I've done on, let's say, TB or domestic violence, sexual violence that has gone up, a lot of this is again coming from NGOs, from activists, from anecdotal evidence, but we don't really have proper studies so far. So for instance, we know that Donald Trump's rallies drew a certain number of COVID cases up, like certain percentage, for instance, but we don't have that kind of number so far for India as such. So the government was essentially trying to control the narrative. And there was, of course, the issue was that there was not a lot of information that was there to share also. But the government did not want to answer questions about testing, for instance. So the lockdown was a central government decision, but health is a state subject. So when convenient, the issues become a state issue, and the questions need to be redirected to the respective states. And when convenient, it would become a national issue. And so in like just getting basic answers was a huge problem.
Sure. Thank you, Disha. Now, the other questions now look at the other way, saying, considering state accountability on one hand, how much responsibility or fortitude to say first of the media's with the kind of news some media houses had put out? Like how much of a panic was caused by media houses themselves in their regarding, and how, in your opinion, how much do you think it affected the spread of COVID in itself?
So a little bit about the media. I think a lot of us who have access to, like a lot of journalists like me, work for English language publications. That's not our readership. That's not our main readership. My parents don't speak English, so they're watching Marathi news channels, for instance, or Kannada news. They're reading Kannada newspapers. So as journalists, we are aware of that. We are aware of how the flow of information is very different from, when we're engaging in English, and it's also the language of quotes, for instance, we're reaching a very small percentage of people. So when we look at the media landscape, we have to also look at the regional language. And I think the regional language news channels actually did far better job of responsibly covering the pandemic than the national language news channels did. Um, in terms of spreading panic, then that's why I went into the details of hard news and soft news, because suddenly you had these editors who consider political news as hard news, doing health reporting, and as health reporters, we can tell that this is so not accurate. And that's a structural problem. That's a structural problem of any industry, for that matter, right? Like when somebody on the top might not really be up to date about the latest or up or in touch with ground realities as such. So I would say the media houses across the board did play a big role in amplifying panic. In some cases, I mean, certainly in all of the sensationalization, the actual, like the basic facts: wear masks, maintain social distancing, those facts have sort of got lost somewhere, I think, because there's some reporting that's come from Bihar, for instance, now during the election, where a lot of people actually think COVID-19 is a hoax. And so the information hasn't necessarily reached our villages or the smaller or people who are not consuming English language news. So I'd say like the media did play a huge role in all of this, in disinformation and amplifying panic.
Following up with this, Disha, how do you think we can ensure that like this even ongoing now doesn't happen and doesn't happen in the future? Because you already discussed in your talk itself about how letting the government regulating it is a slippery slope.
I think it will have to be what we've seen overall, I think, is dissent go down across the board, right? Dissent from activists, dissent from, of course, because a lot of them are behind bars, but dissent from NGOs, dissent from media itself go down. So we would have to collectively normalize dissent, normalize protest, something that happened with the citizenship bill. You saw people come on the streets after a long, long time to really protest. And you saw the government actually back down. So some of it, and the feedback that comes on social media, for instance, news organizations do take it seriously because we have access to the feedback and numbers, right? Numbers drive reporting, for instance, especially in the digital media landscape. So if people are consuming misinformation, or people are consuming a certain news channel that is showing inaccurate news versus a news channel that actually is doing good journalism, I have to say that's also on the people. It's you're getting what you're seeking and what you're consistently asking for. So one thing I did miss out is the fact that you're also seeing emergence of people paying for news media, and I think that will be a game changer. So Caravan, for now, instance, now has a subscription model, as does News Minute, as does News Laundry, and of course, if a news organization is running via subscription, their ability to tell certain stories is much higher because they're not dependent on government advertisers, and also they have ways that they're getting feedback from their readers. So I think reader feedback would be very critical. For instance, with the Tanishq ad fiasco, you had people on the social media saying that we don't really want this ad of showing a Hindu woman, a Muslim husband, sort of that family. We don't want that kind of peaceful narration. And so if as people that's how we're going to respond, then that's the kind of news that might be fed to us also. So one solution is, of course, the emergence of subscription driven model. Second, if people are more vocal on social media, I think that you could drive change. And third is really come out on the streets and protest. That's an extreme form, but yeah.
So you're saying that if people stop consuming these kind of media's misinformation,
Yes.
they would, and if it stops selling for them, they'll start.
Right.
Right, and you don't really need to regulate them.
No. For instance, the news laundry campaign on Stop Funding Hate essentially was where the organization covered companies who are funding news channels that were responsible for spreading hate. And the more coverage that those companies got, a lot of companies withdrew their funding. And so now the news channels will also have to think about, hey, if I'm not getting ads, I might have to tone down. Yeah, that's it.
So we have a question from one of the participants here, Jyotish. She wanted to know, considering the government is one of your only, in some places, the primary source of information, how do you verify the government data you get? Right? Is there any way you can cross-check and know that whatever the government is saying is actually true?
Ground reporting is always a good sort of mitigator of that. For instance, there's a saying in journalism: if one person's saying it's raining and the other person saying it's not raining, your job is to look out of the window to see whether it's raining or not, and not necessarily just report both the sides. So ideally, as journalists, our job was to go on the field. Like I said, during COVID times, because mobility was restricted and all of that, that was not an option. That was not an option for that complete lockdown period, but now it's an option. And so now you are seeing a rise in reporting on what the situation has been in the villages. Now, when in the absence of that, you actually had a lot of NGOs and activists and people that you could connect with in the respective areas to give you information, to cross-verify information. So the NGO sector has actually one of the big sort of sources. I wouldn't Yeah, you can cross check, you can have reach out to people in those respective cities, you can rely on activists, and then at least you get two perspectives. Yeah, and so that's the only way. And ideally, anyway, as a journalist, you're supposed to cross check what the government puts out.
Even in terms of COVID death numbers and all, so you would say the best way to do it is verify from the hospitals themselves?
That's tricky. Numbers, not really. There's no way you can, because you could do a spot reporting in a particular hospital saying, hey, the government has said in this city there are X number of deaths, but in this hospital alone there is like 4X deaths. So then there's something odd here. But in the past few years, in general, I mean, government numbers have come under a lot of scrutiny, and we know they don't necessarily hold up. So, not just the Indian government numbers, I would say that any numbers with respect to COVID coming from anywhere is right now evolving. We would know the exact situation only much later. So right now, we have to take everything with a pinch of salt, and we shouldn't get bogged down by hard numbers, because there are a lot of these are human stories, these are people, these are families that have lost their loved ones. Like, to me, how does it matter if 50 people died or 100 people died? There are deaths. 5 people also dying is a problem, right? Like, so if you can't, I mean, I will not look at a number saying the deaths have come down from 5,000 to 3,000, because I read it as 3,000 deaths. I don't read it as, okay, 2,000 less deaths, because ideally you should aim for zero. So going to these families, trying to tell their stories, I think that should be the bigger focus than just hard numbers.
Fair enough. Thank you so much. Just moving off from this a bit, I'm sure you've heard that recently this digital streaming platforms like Netflix and all is coming under the Ministry of Intelligence Bureau. They're trying to regulate it. What if, say, tomorrow the government decides digital journalism or digital media houses is also regulated?
It could be, it is a real possibility. And there, I mean, as citizens, we'll have to, I mean, it's up to the people. Do we want a free media for the democracy to survive? Then we have to get out on the streets. But we've seen in recent years that the people are also quite like Times Now and Republic are where they are because there are so many people that believe in that content, that want to consume that content. We will always be I mean, we can, any industry for that matter, right? And it's not just media industry, it's also, for instance, fashion industry. There's demand and supply. It's preying on your insecurities sometimes. And so it will have to be up to the civil society as well. I mean, the media will push back as much as the media can, but like I said, a lot of media is owned by politicians, so there's a conflict of interest there. So what an individual journalist like me thinks, the owner of the news organization might not think that way. And so I might actually have very little agency sometimes in if I'm part of a larger organization. And that's true of any system, right? That's true of any industry. So there's a lot of conflict of interest. And as people, I mean, as in a democracy, the biggest power we have is to vote. And electorally, we are saying something as a country. We are consistently choosing something as a country. And then if this is what we are okay with, then this is what it's going to be.
I had a follow-up on that actually. So when we're talking about these digital news media outlets like Scroll or News Laundry or The Wire, uh, obviously the response during the pandemic, one at the surface could read, was a little bit more responsible. So they've been seen sometimes as a bastion of a counter to fake news or disinformation. But at the same time, they're also very limited in terms of resources and staff, right? So how do you think that they played a significant role during the pandemic, given that the resources were limited to go out or like verify news? And like, do you think they are important and integral to the journalistic fabric of India?
Yes and no. Uh, yes, in terms of a lot of modern, and sorry, modern is the wrong term, young people actually read news online. And the subscription model is actually driven by young people who are willing to pay for news. And so, this is something that I have realized as a journalist. You might not necessarily need everybody in the country to agree with you, but you need the decision makers to read you and to be aware of the conversation that's going on, right? So let's say something like India Spend might not have a mass audience, but it gets read in the policy circles, and it gets read in the circles that might be making the decisions. So do these news organizations make a difference? Yes, because also um, international news organizations read English. So when English language news organizations publish something, the odds of it being amplified in a forum like UN, for instance, like I've reported from the UN last year and I was asking questions there. And so I mean, I was part of India Spend at that point in time, and I don't know how many people directly read India Spend, but I had the reach to ask the relevant people questions. And so you might want to think about that as well, right? The impact, like, do you need really a mass readership to drive impact? Not necessarily. So, I mean, in short, the answer is that I do think that digital media platforms can drive impact. They might not have the mass readership, they might not have the resources, but even for the resources aspect, you now have a lot of independent organizations stepping in to give grants, for instance, for reporters. So like I did an investigative series looking at how India's environment ministry was opening up its protected areas to to infrastructure projects, along with a colleague of mine, Tish. And Tish and I were funded by a Pulitzer Center grant. And I've done a lot of my ground reporting actually using grants from International Center for women journalists, for instance. So you have a lot of these funding models that are now coming in to counteract these systemic problems.
Thanks. So I mean, just following up on that as well. So where do you see the future of health reporting? You said before as well that this thing gave prominence to health reporters and it suddenly became a very important thing. You're talking about funding as well. Now, when this funding is coming in, is there going to be a sustainability element for people on the health beat, that these funds are going to be properly allocated to health reporters and bring it to the station where it needs to be? Or is this just like when COVID goes away, nobody cares anymore? And
We'll have to wait and watch. We'll have to wait and watch in terms of how people. Okay, so one of the basic problems that I felt about health reporting is that people don't think of health as a government's responsibility. People don't think that malnutrition is a disease, or that it's government's job to build you hospitals. And this is a conversation that I have a lot with a lot of elders. I just to get a sense of how they see things, and I realized, like, they don't feel the voters don't necessarily feel the need to ask for a hospital. They feel comfortable asking for a temple. So why not a hospital? Or education in that sense is still something, like build educational institutes, build more IITs is an aspirational middle class value. So why not build more hospitals? Why not build more government hospitals? And the reasons also that a lot of middle class Indians actually don't use government health services. So about 70 to 80% of our market is driven by private healthcare. And so that's an important element to look at, because so people are not using government services. Who are the people who are using government healthcare? In most states, they're the poorest of the poor, right? They're not even just the poor. If they're poor and they can borrow money, they will do everything in their capacity to borrow money and go to a private practitioner. So and this is not to say that the government doctors are not good. This is to say that over a period of time, state governments have consistently underfunded public health care. Central government has consistently underfunded public health care. And so the voters don't ask for services that they don't use. Of course, there are certain states that are exceptions where public health care is really good, but that's not the norm. So will we see health become an issue? Hopefully, yes. Because there are a lot of health journalists around, and we've seen this hard and soft news barrier go down. And I don't think once it's out there, it's easy for anyone to pretend that health is not an important issue, or that people don't care about health, because now we have hard numbers about how many people read the health stories versus how many people read a politics story. So we know that people care about health, for instance. And the same thing is happening with environment, air pollution, climate change. So this is actually an opportunity for journalists to drive these intersections and explain the connections between air pollution, government action, public health, and all the entire chain, and how that works. In terms of whether this is sustainable, it could be sustainable. I think it's possible to. It doesn't take that much money, for instance, to do ground reporting. And if there are, organizations or like people, companies have corporate social responsibility. If they were to just fund one or two journalism positions to report on healthcare, I don't know. It's also tricky. I don't think money is the primary factor. It's also if somebody's funding you, and if they put in certain criteria of this is the only thing that you're going to report on, that could open up a Pandora's box. Right now, that hasn't been such an issue, but going forward, because you will have to rely on a lot of external funders to continue doing this reporting, that will be a conversation that we'll increasingly need to have.
Very interesting. Thank you for answering that. I think we have time for maybe at least one more question. Shaurya, over to you.
Yeah. So just two quick questions. One is, considering that the colloquial, regional medias and print media's reach is much higher than the digital medias, right? And how much of disinformation or reporting issues do you think happened during COVID in those regional languages print medias? And would you say advocate for a stronger regulation for them?
I won't advocate for regulations for anyone, really, because, like I said, that gets into tricky territory. A lot of it can be mitigated by training journalists. So there are organizations that hold workshops for journalists in different areas, right? As health journalists, actually, we have a lot of access to, and even in the environment beat, because I write both about health and environment, and there's a lot of access to training material and resources. The regional language journalists actually don't have too much access to training resources, to scholarships, to fellowships, to grants, because grant organizations are also, if let's say they're government grant giving bodies in US and they're getting a grant proposal, the proposal needs to be in a language that they can understand, and that itself limits a lot of funding potential. So I think it's time for us to expand the training, and it's been a conversation for quite some time where the regional language journalists, they are aware that they play a huge role in educating their readers, but the funders have not really valued them as much. So that entire ecosystem will have to change. But then again, with COVID now, what's happening is newspapers, I mean, the media industry, the way people are reading news and consuming content is changing drastically, and people were hesitant to buy newspapers. So, and India is actually one of the only newspaper markets that was growing until COVID happened. Across the world, newspapers actually a dying market. So we'll have to wait and watch in what way this pans out. But certainly, regional media needs more training opportunities, and it needs more money. That's maybe going to the journalists directly in the form of grants and not via the organizations.
Fair enough. Thank you so much. Just one final question, and then we'll close with your final comments. It's quickly on, in cases where misinformation or blatant disinformation by a media house leads to loss of, say, life or property as such, do you think in those instances the media house itself should be held liable? I mean,
yeah,
not about government regulating it. It's just in case they follow fake news and something happens, somebody dies or somebody's house is burned, somebody's car is burned and all. Do you think in that cases media houses, the house itself should be made liable?
It'll be tricky to establish liability. I mean, the guilt, like abetment to suicide, right? Somebody writes a suicide note, but is that enough to jail someone? It doesn't. In practice, it doesn't work that way. It's very difficult, and there are lots of factors that come into play. I don't know what to say to that. I do know that when there are guidelines in place, when there is the fear of some sort of regulation coming down on you, two things can happen. One is that you are very worried about saying anything wrong, so you self-regulate so much that you don't even say the right thing. Or two, you might stick to saying the right thing, but it'll have its fallouts as well. Then it'll have the fallouts would be that media might just decide, let's not cover this issue at all. And that would be getting into a tricky space as well.
Thank you so much. So we'll just close with your final thoughts on this.
So firstly, thank you for all the people who are on the webinar, and thank you for asking questions and engaging with the subject. In terms of disinformation, I think where we stand right now is we've just about begun to have this conversation. We've just about begun to see the fallouts of social media, of WhatsApp, of the way the news model is changing. We've begun to see what the pros and cons are. The COVID pandemic was a good example of how and what the gaps are. So now we know what the gaps are, at least. So we can work towards a solution. So I would see that as a silver lining, that we at least know where, what are the things that we need to make sure that we plug. But the second thing is, it cannot just be media. It cannot just be social media platform. It will have to be a combination of people. It will have to also, and the civil society will have to play a very big role in what we want and what kind of country do we want to be. And all of this is a reflection of who we are, and not necessarily what is suddenly happening. This is who we are. This is what we consume. This is what we want to consume. And if we want to consume something different, then we should go ahead and consume something different, because the options are available, and it's possible to tilt this balance, but it's a matter of choice. And if we're making the wrong choice, I'm not sure if we can always, of course, media is accountable, and so is the government. But there are ways to push back, and we ought to exercise those ways. Thank you.
Great. Thanks a lot, Disha. I must thank you for coming on board and giving us your insights and your experience and your thoughts on a lot of these questions that all of us grapple with now on a day-to-day basis, for sure. So with that, I'd like to close the Q&A session and close the webinar and the discussion. Disha did talk about the need for having workshops and training modules where journalists and people interested in journalism can actually equip themselves with the tools required to maybe fact-check information or appraise themselves of what misinformation, disinformation, and sort of fake news are. So to that end, we're also having a conference at the end of November on the 29th called the Fake News Conference. This is the second iteration of it. I'm sharing a link in the chat box. So anyone who's interested, please do check it out. We have people actually from Boom Live coming there and training us on how to do these things. We also have a feedback form that I've shared. Please take out a few minutes to fill that and let us know how the session was. It helps us immensely in planning future programs like this. So with that, once again, thank you, Disha, for coming on board. I'll give you a call after this and we'll have a chat, I'm sure.